What's going on? Okay. My computer folks. My computer audio keeps.
You heard that. Hi all, if you can you're able to
Muted. Unmuted.
Hi everyone, this is Steve with the Afterschool Network. We're going to get started shortly. So within a couple of minutes we'll start the time.
Muted. Unmuted.
We're going to get started, folks. Thank you. Sorry for the delay. We've had way more folks than they can. Phil, can you just please confirm for me that you can hear me right now? Can you hear me? We're having some audio here. We're going to hold on one second.
Muted. Unmuted.
Can you hear me on the line right now? Yes.
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 All right, great. Sorry about that, everyone. Thank you. Sorry for the trouble. We are going to jump right into it. I'm going to ask folks to please turn off your audio. Our meeting is full, so if there are multiple of you from one agency, we're going to ask you please to open up the spot for another person. We have over 153 attendees in the room, so we are going to get rolling without any further ado. So thank you for joining this call. Again, apologies for the delay. We are the Alaska Afterschool Network. We're a program of the Alaska Children's Trust. Today's call is the COVID-19 health mandate in regards to summer programming for kindergarten through 12th grade. What we'd like to start off first is just with some real quick meeting go-to etiquette. Again, you'll see on the screen right now if you're on the screen. If not, you should have had the slides emailed to you earlier today. Please make sure you're putting yourself on mute. Do not place the call on hold because otherwise we will hear your hold music. The call is being recorded today and we will be taking notes that we'll be sending out to the field afterwards. If you would like to have your web camera on, you're welcome to, but you do not need to have your web camera on today because it helps save bandwidth for those who have weaker internet connections. So real quick, we wanted to set just some group agreements in regards to our call today. So the first thing we wanted to ensure is keep all comments, questions, and concerns concise. Because there are a lot of us on the call today, we are going to be really focusing on trying to get to solutions. So talking about moving towards solutions. We want to make sure we're giving equity a voice for folks from around the state. Thank you again all for joining us. We want to make sure that we're staying youth focused. As a collective field, we want to make sure that we're focused on how are we advancing summer programming for children, families, while keeping them safe, as well as our staff and our own organizations. Also, we want to remind everyone that we're all in this together. Kindness does matter. This is something we've never faced before as a collective country, field, or profession. So thank you. Again, keep yourself on mute, and if you need to, there is a call-in phone number. How our call will work today is we're going to be going through each part of the health mandate. This is a chance that we will be really looking for what are your questions, concerns, and comments about specific parts of the mandate. We recognize that this is just one part of a broader picture. This is a very fluid situation with COVID-19. As of the most recent mandate, which we will be talking about, which is Mandate 16, Attachment I, which opens camp and summer programs, we will make sure that we will be moving forward. So one of the things we like to really ground folks on is making sure that we remember that, you know, a kind of core piece behind summer programs is that they help keep kids safe, they inspire learning, and they support working families. A key part this summer that we're all really focused on is how do we keep kids and staff safe this summer, both safe from the spread of COVID-19 and also safe from other things that may be challenging that young person. Also, as well as we know that we are a critical support for working families during this time of need, especially as the economy continues to open up. We know that this is increasingly, your programs will matter to support families who are working. And as always, we're inspiring learning. Just real quick on impact of summer programs, you all know this, but just wanted to highlight and raise this up. What we know typically during a summer is summer learning loss can occur for all age students, especially elementary age students, who can lose sometimes up to 25 to 30% of their school year learning if not engaged in summer activities. If students experience 5 to 6 months of limited or no learning as a combination of the COVID crisis and lack of summer engagement, we may see that achievement loss double, which could effectively erase out a lot of the gains made last year. What we also know from national and local surveys, 71% of Alaskan parents agree that summer activities maintain their students' academic skills and help them learn new things to stay on track for the fall. What we are going to do today, so we have some guests that are joining us. I don't think Dr. Zink was able to join us, but we do have Dr. McLaughlin, state epidemiologist and chief Alaskan section of epidemiology, who is on the call and going to be listening in. We also have Erin Hardin, who is a special assistant and legislative liaison for the Department of Education and Early Development. And I'm going to give them an opportunity. Dr. McLaughlin, if there's anything you would like to kind of share at the start of the call to help frame where we're at right now in the pandemic.
Sure. This is Joe McLaughlin. Can you hear me okay?
We can. Thank you.
Hello? Oh, good, good. Excellent. Okay, I had a difficult time calling in, but I'm glad this worked. So thank you, everyone, for this opportunity to join you all today and provide a little perspective on where we're at with COVID-19 in Alaska. So I highly encourage folks, I'm sure most, if not all of you have perused our website, and you all probably know that we have a data dashboard. And so if you have access to that dashboard now, I'd encourage you to just go to it and take a look at it with me. What the dashboard shows is in the upper left-hand corner, it shows you sort of where the highest case counts have been by residents. And you can see that the highest case counts have been in the Anchorage area, as well as up in the Fairbanks area. And the epidemic peaked in mid-March. And ever since mid-March, we've been on sort of a slow but steady decline. And now we're to the point where over the last week and a half, 2 weeks, we're really just looking at single-digit cases. And most recently, you know, on the order of 1 or 2 cases per day. In some days, we've actually had 0 cases reported. So this is about as good as we can expect or hope for right now, given the state of the pandemic. not only internationally, but nationally. We do currently have the lowest case counts in the nation, but that could change. And so we want to be very vigilant to make sure that we're not opening things up too quickly so that we see an acceleration event occur. In the table in the middle, upper table, that shows the total statewide cases by age group. And you can see basically that our distribution of cases by age group roughly mirrors what's happening nationally and even globally. And you can see on the far left-hand side, the percent total for kids under 10 years of age. It's a very, very low percentage. It's about 2-3%. And this is what we're seeing, as I'm sure you're all aware, is that the number of cases in children globally and nationally is very low. We don't fully know why that is. It could be that kids are getting infected, but they're actually not developing symptoms, or if they do develop symptoms, they're very mild and even difficult for the child to detect. It's unclear the role that children play in transmission of COVID-19 in communities. What we know from other respiratory infections is that kids play a big role in disease transmission in communities. However, by and large, kids are symptomatic when they have those other respiratory infections. So we still have a lot to learn about the role of children in the COVID pandemic. But suffice it to say, it's very encouraging, and we're all very happy that kids tend to be overall pretty protected from COVID-19. Now, we do occasionally get kids who wind up developing more severe disease and requiring hospitalization, and unfortunately, some children have certainly died from COVID-19. So one of the questions that frequently comes to our desk is, so are we being successful in flattening the curve in Alaska? And when you're thinking about curves, there are lots of curves that I'm sure you've seen, but the curve we think about as epidemiologists is the epidemic curve, which is in that lower left-hand box. And not only have we flattened the curve, but the curve has been on a downward trajectory, like I said, since mid-March. And our hope is that we'll be able to keep it at a low level through the summer months. Now, one of the questions that also comes up frequently is, well, we know that flu and cold viruses tend to kind of go away during the warmer summer months. Will that also happen for COVID-19? It's a good question. The answer is probably not. It probably won't go away with the summer months, but the summer months may be helpful in just decreasing that R0, that transmission rate, a little bit. And we don't know exactly why flu and cold viruses go away during the summer months. There are a lot of theories out there about why that might happen. One is because the mucosa, the mucosal lining of your respiratory system, is under a lot of stress during the colder winter months where you have very dry air, whereas in the summer months we tend to have warmer air and more humid air, and that allows for a more robust nasal and respiratory mucosa, and that's our first line of defense against some of these viral pathogens and bacterial respiratory pathogens as well. Another reason why we think that these respiratory viruses don't do so well in the summer months is because people tend to be outside more. They're not crowded indoors as much. And then lastly, school is out of session. We know that as soon as school goes into session, that's when we start seeing big increases in our respiratory viral transmission rates and infection rates. So those are just some of the reasons. So our hope is that, the summer months will play a role in helping decrease transmission, but we are expecting that COVID-19 will stick around throughout the summer. And then I think everybody who has really studied this is also expecting that in the fall, we'll likely see another wave of COVID-19 that will impact, North America. So, but, nobody has a crystal ball on this one, so it's difficult to say for sure exactly how this is going to play out. So far in Alaska, we've had, I'm just going to update this page one more time, 372 cases. Let me just make sure that that's still the current. Yep, 372 cases. We've had 38 hospitalizations and 10 fatalities. So maybe in the interest of time, I know it's getting late, I'll go ahead and leave it at that and be available for questions.
Great. Thank you, Dr. McLaughlin. We're going to hold questions for the time being. Next, I want to see, Erin, were you able to get online with us? Erin Hardin from the Department of Education.
Yes, this is Erin. Thomas, can you hear me okay?
Yes, we can. Thank you, Erin.
Wonderful. Well, thank you so much for the invitation for the Department of Education and Early Development to participate and be a listener on today's call. I'm Erin Hardin, and I serve as the Special Assistant to our Commissioner of Education, Dr. Michael Johnson. And I just wanted to start by saying that Commissioner Johnson sends his sincere regrets that he is unable to join the call today. Was very much looking forward to it, but he was invited to be on a very similar GoToMeeting call with his fellow state education chiefs across the country right now to talk about restart and reentry efforts for the fall. So I appreciate the opportunity to listen in on behalf of the department. I just want to start, and again, I'll keep my remarks very brief because I want to listen to the conversation, but just say a sincere thank you for all of your agencies and partners' efforts and your commitment and creativity to supporting our students during this pandemic. It is truly inspiring. We have shared goals here at the department with the Alaska Afterschool Network to ensure students' safety and continued learning continues through this crisis. One of the first resources that the department stood up shortly after the virus hit Alaska was a website called aklearns.org, and I just wanted to share it as a resource if your agencies were not aware. We are constantly putting up resources to support school districts, families, students, summer learning opportunities, etc. And we very much look forward to receiving resources from the field. And so I just wanted to share that if you haven't had an opportunity to go visit. Again, it's aklearns.org. And if you and your agency have resources that you're using and really looking forward to seeing everyone's creativity with how to ensure summer learning continues, we would greatly appreciate you sharing those with us so that we can make sure that we post those on the website for statewide use. We at the department received a lot of questions about access to school facilities and buses for summer programming. And so we are very much in a support role alongside the Department of Health and Social Services to review all of your questions and help them to provide guidance. So very much look forward to this afternoon's conversation to listen in and support the Department of Health and Social Services. The other note I wanted to share with all of you is that through the federal legislation that passed recently, the CARES Act funding, there was funding specifically set aside for local school districts through two different pots of funds. One is the Elementary and Secondary School Emergency Relief Fund, commonly referred to as ESER, and there's a second pot called the Governor's Emergency Education Relief Fund, sometimes referred to as GEAR. Both of those pots, our school districts are going to be receiving money to help support continued learning. They have a great deal of flexibility in how they choose spend that money, and one of the many allowable uses of those funds is to support summer learning efforts. So I encourage you, if you haven't yet had a conversation with local school districts to find out what those partnership opportunities might look like, just wanted to let you know that there is summer learning is certainly an allowable use under CARES Act funding. Lastly, I just wanted to share a resource at the department. We're starting to get some questions about thinking about summer learning and how to provide meals as part of summer programming for students and what that looks like during the pandemic. And so I just wanted to let you all know that if you haven't yet met Rhonda Biles with the Department of Education, She serves as our summer food service coordinator. I highly encourage you to reach out to her and connect. The application window for our summer food service program is currently open, and she would be happy to help answer any questions. And we are looking at and have already applied for a number of waivers. One of those being if you're thinking about your summer learning programs, about conducting things virtually, we have waivers for things like non-congregate feeding. So again, I just want to share Run the Bibles as a resource. So I'll go ahead and stop there, and happy to listen to the conversation, and thank you again for the opportunity for the department to participate. Thanks, Thomas.
All right, well, thank you both so much on providing that overview. One of the things that we did want to mention as well, you should be able to see, we've been placing it a couple times in the chat box, there is a virtual sign-in sheet as well that we're doing to be able to collect people's email addresses and programs so we can make sure to connect you with follow-up from the call. As we stated at the beginning of the call, the hope and goal of this call is really to be a session for us to listen from the field. The departments, both Department of Ed and Department of Health and Social Services, really just been doing a phenomenal job on listening to our communities, listening to our education providers as well to really address and support children and families during this time. The other thing I do want to say is right now we are functioning underneath the health mandate 16 and attachment I. That may change as the continual open up may happen if we move into a different phase of the opening up, or we may take a step back. So everything that we're discussing today is subject to change, and this is really an opportunity again for us just to elevate and raise concerns, to seek further guidance or resources and supports for the field to be able to help support children and families this summer. Without any further ado, we're going to jump right into the mandate. How we are going to do our call today is we are going to be allowing folks to both type in the chat box and also verbally give any type of feedback in regards to questions, concerns they have. I'm going to ask for folks to stay concise on this. We will be breaking it down underneath the COVID mandate. We are going to be looking at each of the sections inside of there under requirements for operation. The first section is simply, is a short one. I just put in the chat box that mandate, is definition of a group. So this one has a small piece to it. So a group includes the number of children in a distinct unit and does not include staff. And so this is one where we've had some questions in regards to how it's defined at the beginning and then where it's defined later on. Due to other parts of the mandate, a group is considered a group of 10. But we'd like to open up if there's any brief comments in regards to questions about a group in the definition.
I have one quick question. We were not able to get onto the Go Meeting website and we're just on auto-ly. Who do we email to let you know we're on this? Okay.
We will, you can email myself and you can do that at tazarella@akafterschool.org. So Thomas Azarella.
Thank you.
All right, so we are looking at the health mandate underneath the group piece.
So I had a question in regards to group piece there. It says that a camp may have several groups within the organization, but no more than 10. Is there any? I don't recall seeing any distancing required. So, like, say you were operating out on a football field, do you need to have a group of 10 with 30-foot separation or things like that? What kind of distancing are you talking?
Great, and that's a good question. And if folks would too, when you're asking questions, please make sure you say your name and organization as well, so we have it for the minutes. So that is mentioned later on in the mandate. We'll take a look. Some of this as well, some of these questions, please ask them. This is not necessarily designed to be a question and answer today, but this is really a chance for us to raise those questions up, we will then be feeding it back to the field as well, and we'll make sure to pass out that information. But if at any point, if anyone from the Department of Health would like to jump in as well and kind of answer any questions, feel free to as well. But we will get to that one in a moment because it does pop up again. So we're next looking at underneath the health mandate. This is under requirements to operate. This is under the social distancing guideline. I think this is where the last person that was kind of speaking on the questions. We know one of the questions folks have already raised for us is the question around what exactly is a COVID-19 mitigation plan. We are working on trying to get some guidance. We're also working with our partners in the early childhood field who have already started opening programs to be able to see what those look like. So we know that is an area of concern. Would love to, though, hear any other questions folks have around or concerns around social distancing in the group size. So we heard the one question about if you have multiple groups, you know, how do they need to stay apart? Those groups do have to stay isolated from each other. So there is a distancing required, but children inside of the one group will not need to socially distance from each other inside of that group. I'm seeing inside of the chat box what permission or information should be gathered with or from students for participation. What cleaning procedures are needed to turn the space over. So there are some questions in regards to that. What we know right now in regards to best practices around permission, so we should have a kind of full description of that child's health. Each day, as we'll see inside of the mandate as well, there should be an initial screening done with the child and the family, ideally, to be able to screen for that child's wellness coming into program. In terms of cleaning, we're recommending you follow the CDC guidelines on cleaning for childcare and camp program. It gives a kind of guidance. We'll also be putting together some best practice recommendations that are starting to be developed nationally from several other youth-serving agencies. So we'll be sharing it as well as templates for you to use. Under the social distancing one, would love to open up underneath that section. There were some questions about physical exertion. So physical exertion, right now, as Darren with 4-H Juno mentioned in the chat box, that it must take place only outside. So physical exertion that is subjective or voice projection as well. So this would include things such as camp songs or cheer circles or other activities that you're exerting your voice. Those do require to be outside, again, so you have the additional space and the ability for it to dilute into the air. The exertion outside as well has to be outside. That is subjective, but we would encourage you, anything that is more than a walk should really be conducted outside this summer at the current time. So another question came in from Matthew, said with 100% outside, program that's 100% outside, such as hiking programs, does it need to fall into participant size of 10? Yes, so the health mandate does require that groups of no more than 10 can meet. There can be multiple groups of 10. So say if you typically run a program with 50 kids, those kids would be in 10 separate or 5 separate isolated groups with a max of 10 children inside of their group. This mandate right now does cover any form of youth programming that is occurring during the summer. So this includes clubhouses, teen programs, summer camps, culture camps, and others. Parts that are not included inside of the mandate currently are residential youth camps and sport programs in which they are competitive teams in which they're meeting. You still have to meet the mandate and keep kids separated in groups of no more than 10. I'm seeing a couple more. Any other questions on the social distancing piece? think one of the key pieces as well inside of this that we're seeing is that there are no visitors or activities such as field trips that would involve another group. We know that's a significant change that many programs rely on their ability to bring in outside specialists or conducting field trips to get kids off-site and experience different parts of our beautiful state. So that is something right now that is prohibited under the current mandate. What is not prohibited is virtual field trips. There are lots of providers. We're currently going to be working towards putting together a list of where students can conduct virtual field trips to places as Alaska Zoo and several of our national wildlife refuges as well. So virtual field trips okay, in-person field trips not okay. That also should relate to any form of transport with kids as well, in terms of bringing groups from one location to another location. That is a great question Daniel asked inside of the chat box. Does group size apply to summer school programs as well? I don't know. We'll list that up, and I would maybe push that back to the Department of Ed to see if we can get some clarification on that. Anyone else, feel free to unmute your phone and ask any questions around the social distancing mandate, which is Part B inside of mandate 16, Attachment I, Section B, social distancing.
Thomas, this is Vicky. Oh.
Go ahead, and I think that was Christy that might have been on. All right, not sure. Well, one of you may go first.
Thomas, this is Vicky with Trailside Discovery Camp. Just going back to your field trip comment there, with visitors and activities such as field trips involving other groups being prohibited, what happens if parents drop off at a different location? Is that field trip allowed to happen? If it's like the main site, but then you want to go on a hike somewhere else? Just kind of a little bit of guidance on how to make that work.
Yeah. Great, and Vicki, that's something we can do some follow-up with. So I believe, if I'm hearing it correctly, what you're discussing is if a group went from your camp program and then moved to like either bike ride or had a van shuttle and brought them to a trailhead, would that be prohibited? Is that what you're asking?
Yeah, it's just kind of a little bit more clarity about the field trips, like all field trips completely prohibited, or what happens if you didn't involve other groups or a van? Just kind of those thoughts going through our minds here.
Great. Yeah, we can follow up and get some clarification and guidance on that. What was the next question or comment?
This is Corey Braun. I'm with the City of Kodiak Parks and Rec Department, and one of my questions is in regards to our summer program. Involves our use of our swimming pool and social distancing and or face coverings for staff, as staff are engaged with the kids in the water. I think that poses a potential. I don't think that is realistic, and I just kind of wanted to get some guidance on that.
Yes, thank you for asking that question. So we have gotten some questions that came in before the call. That was one we asked. So currently at this time, swimming pools should not be in operation to reduce the potential spread. So that is right now where we're at, so that there shouldn't be any form of water. And I believe Eliza just put there's no evidence of spread. But right now, we're saying that swimming pools are off. We'll get further clarification on that as well, and what that means in regards to ponds, lakes, and rivers that may also run swim programs as well.
Hey, Thomas, this is Eliza. And I just included that in the text box. I had a conversation with Dr. McLaughlin just prior to this, and went onto the CDC website just to get further clarification. And there was an update that was provided on April 23rd. So that's the most recent data we have around the virus and spread. No evidence of spread in pools or tubs or water play areas. And exactly, Thomas, that's a question that we'll take back to our leadership to take a look at for further clarification around that mandate.
Yeah, and this is Joe McLaughlin. I can just add to that. You know, CDC has gone on to say, in addition to what Eliza just mentioned, that proper operation and maintenance, including disinfection with chlorine and bromine of these facilities, should inactivate the virus in water. So that'd be for chlorinated or brominated pools. But when you're swimming outside, you know, it might be a little bit different. But that's kind of the extent of the CDC guidance on swimming at this point.
Great, and so we'll put that on the list. Also, I do see several folks have also asked about other forms, so things such as sprinklers. I know even giant slip and slide some programs have. So those will be all part of the aquatics part that we'll ask some questions and clarification on. There's also then some questions around transportation. We're also currently seeking clarification on that. We know a huge equity barrier issue is kids' ability to get to and from program, and many programs provide transportation to and from program. So we're currently seeking some guidance as well around that transportation piece. We're going to switch to the next section for the sake of time, which is capacity. And this is one where we've had a lot of questions. So this is about group size limited to no more than 10, and about, you know, is that 10 kids or is that 10 including the staff member? This is an area where we're also seeking some clarification as well. And I was wondering if either Dr. McLaughlin or Eliza, if you're able to kind of share anything on that front. All right, we will. Go ahead.
Yeah. Hi, everyone. Around the capacity piece, so the questions related to kind of the registration piece around camps encouraging registration for longer periods. You have opportunities to be able to sign your kids up for multiple weeks versus 1 week, minimizing those mixing of participants. Again, you know, there's the out-of-state travel, so the interstate travel with that 14-day quarantine requirement, which also applies to staff and those families. I think that was a really good question about, you know, the staff with the kids. So if we're talking, you know, really in the mandate, here with CI, group size limited to no more than 10. So I believe that includes the coach or staff as part of that group of 10. But that was a really good question, so we can further clarify that piece as well.
Great, thank you, Eliza. We have that as well that we'll seek some clarification about sport programs that have physical contact. Again, as of now, we are running under the best guidance in regards to keeping kids safe and keeping staff and coaches safe as well, which is reducing the amount of physical contact. That should also, though, this applies underneath the capacity piece. So you're allowed to have multiple groups of 10. Those groups of 10 may not intermix. So if you had a group of 10, they cannot play another group of 10 in soccer, football, or any other sport because they are then intermingling. So those groups do have to stay separate under the current guidance.
Thomas, it's Vicky here again from Trailside. A question on that one is, it says including staff, but what about like program managers or site managers or healthcare? Like your health supervisor, when do they have to go in between each staff for those kind of behavioral needs or anything?
Great, and that, Vicky, is something we'll bring back as well as what does that look like, that guidance, because we know in particular camp nurse, or if you bring on an additional health provider this summer, may need to be going in between groups, so we'll check for guidance. As we know, also program management also frequently goes to check in on groups. So we'll get some clarification on that ability to do so as well, and what are the best practices around there. As well as one of the other pieces that I know we've received a lot of questions, as Eliza was mentioning, is around that registration piece. We are encouraging folks, if you're opening your registration, to encourage families to sign up for multiple weeks. We know frequently in some of our larger communities like Anchorage, Juneau, Mat-Su, and Fairbanks, families will program hop, so they'll go multiple different camps throughout the summer. We're encouraging families this year to stay at one program so that we can reduce, again, that contact between multiple kids, or stay at a program for a longer period of time. That they may register, encourage them to register for multiple weeks, sessions in a row, opposed to spreading it out throughout the course of the summer, to help reduce, again, the amount of kids coming in contact with each other and others. Any other questions around the capacity section inside of the mandate? I see some in there.
I do have a.
Go ahead.
I do have a question. This is Jeannie Kirkland from Cordova Ranger District for the U.S. Forest Service, and we put on a fish. It's kind of a fish day event, and we have different stations. And so I was wondering, how would that look? How can we do something like that safely? And do we need to put everyone into groups of 10 and move through the different stations, maintaining the same person leading those stations? Or, because we normally have one person at each station who, or one or two, who help with that station, like in fish printing, knot tying, casting, tackle making, that kind of stuff. How do you perceive that we could do that safely?
That's a great question. So some of that is as well in the guidance. So there should not be things that are multiple use and share right now under the guidance. So an example, just since I'm not 100% familiar with yours, would be an example of markers. So say if there are markers you're using for an activity, the ideal situation inside of the camp program is that each child has their own marker set. We know that's not realistic for a lot of programs, but what it would look like instead is, instead of just having a set of markers that multiple kids are using, it would be, here's the set of marker that these 10 kids are using. If they need to be used again for another group, those markers need to be sanitized before they're being used by the next group. Again, to reduce the transmission of germs going across, we need to ensure that things are cleaned in between. So this will require a lot of us thinking. We might not be able to run the program as we typically have, where we have lots of group rotation, or maybe just one supply that every kid goes through, say a telescope that everyone's using, or a pair of binoculars. We're going to have to really reduce and change around some of those things and think creatively. So I know it's not getting exactly to your question, but some of that we are still kind of working through what exactly that guidance will look like.
Okay, thank you.
The next section we wanted to look at, go ahead.
This is Rebecca Strong from Canarsie. I just had a quick circle back on group size, limited to no more than 10. Group is defined in the mandate as only counting the children in the 10, correct? And not the staff? So
it does, great clarifying. So it does inside of section 1 define group as a group. The number includes children in the thing, does not include the staff as in section A. It then goes down to section C, which then has CI, which group size is limited to no more than 10. That's where we're going to get a little clarification. Also, do know that the state mandate can also be superseded by a local municipal one. So here in the municipality of Anchorage, I believe we still have a size of no more than 10, and that is where we're going to have to seek local guidance as well to make sure that we're meeting both the state and municipal guidance. So we are going to be seeking some additional clarification on that because right now it's a little vague. Again, your local health authority may be able to place a more stringent mandate as well from what the state has. So we'll be following up and getting some clarification on that group size piece. All right, the next section we want to take a look at was hygiene protocol. And I am going to apologize because we started late. We're running late, so we're going to kind of breeze through some sections. Hygiene protocol, we're going to open up questions that you have, concerns around the protocol. We know we've heard a lot about availability of sinks to be able to hand wash in. This is one, though, that we really want. We know one of the number one ways we can stop the spread of the disease is by washing hands. And kids are constantly touching things. So that is a piece we are working towards. What other questions do we have around the hygiene protocols? All right, not hearing any. I'm going to keep going. Our kids required to have a separate restroom. So Curtis asked a question around, Curtis from the Dome asked, are kids required to have separate restroom facilities per group? 10, what is the definition of a facility? Curtis, great question. Those are some of the things we are seeking clarification on. As of now, we will consult with the Department of Health in regards to what makes the most sense. Key part that we're seeing inside of childcare facilities right now and the way that they've been doing it is that they are just ensuring every hour the bathrooms are sanitized and wiped down, or in between groups as well. So we'll help kind of dig out some guidance around that bathroom piece. I have a feeling this summer there's going to be a lot of extra porta potties in programs. We also have some questions in regards to recommendations about playground equipment and sanitation. We will seek some further clarification on that as well. So whether or not we should just keep kids off of playground equipment or whether or not that can just be sanitized. The next piece we're going to take a look at is the requirement to operate. This is staff operations. So this is by far the largest section inside of the mandate. So I'd like to open it up. Some key parts to this is about face coverings, so that employees are required to wear a mask during program, and that we should also be encouraging children as well to wear masks that are older in age. I'm going to open it up for any questions, comments in regards to staffing and operations.
Hey, Thomas, this is Liz in Homer with the Rec Room. I'm just wondering, because you guys are so wonderfully organized and have such amazing resources, is the mitigation plan that should be written up, is each separate program and organization going to do, I guess, just one of their own? Or is that something that we can collaborate on somehow?
Yeah, so this will be based on your own organization, because every organization on this call, we have a wide variety of partners on the phone. We will help provide some best guidance around that. We can also help folks look through the mitigation plan to give recommendations as well.
Cool, thank you very much.
Yep. And there were some questions about the age of youth in regards to masks. All kids should be wearing, we're encouraging all kids should be wearing a mask. They just should not be under the age of 2, which most of our programs do not provide care to kids under the age of 2. So we are encouraging masks. It's also a great arts and crafts activity. All right, for the sake of time, we're going to keep ourselves moving on to section.
Thomas?
Yep.
This is Christy from Hope.
Uh-huh.
Is there by chance a template that we could put together to help us walk through the mitigation steps?
Yes, we're going to be working on putting that together. We are working with partners from across all 50 states. as to providing some of that guidance. We're also working with the early childhood field that's already been having daycares open to be able to see what best practices have already arisen. So we're going to hopefully provide some additional kind of boundaries for folks to be able to follow through.
Hey, Thomas, this is Cheryl from Raleigh down in Juneau. I have a question. Are businesses required to provide hospital level PPE for their staff under this?
That is a great question. We will find out. As of now, underneath the mandate, the way it's stated inside of the mandate, and that it's underneath staff operations inside of it, clothing masks must be worn by all employees. So I believe they can just operate under using a clothing cloth face covering.
Hi, Thomas. I can clarify. This is Eliza, and that's correct. Face coverings, cloth is fine. PPE, kind of the medical grade PPE, should be really reserved for our healthcare, frontline healthcare personnel.
We have some other questions. Currently, there isn't, so residential camps are not allowed to be in operation under this part of the guidance as well. I would also extremely encourage programs that function as a drop-in, so teen centers or other programs, to be hesitant and think through what exactly that may look like for operations. There's lots of other questions in here about disinfectants. We will be following up with those as well. Pam, I can follow up with you, and we'll put out as well for sanitation. Sanitation should be occurring on a regular basis. An hour is one of the best practices right now being outlined by CDC. It should also, anytime that there is a potential transmission between a group size. So if one group, say, is using the gymnasium should be all surfaces in the gymnasium, such as bleachers, balls, or doorknobs should be sanitized before the next group begins using the gymnasium. The last thing we wanted to do is share with folks. So again, thank you. We apologize for the delay. We had way more folks on the call than we were expecting. It's fantastic. We are going to be sending out two things. One, if you have not yet, please make sure that you give us your email address. There's a lot of folks on this call that we do not have the ability to circle back to you and share resources. So please contact us. You can reach us through our website, akafterschool.org. Again, akafterschool.org. We will be having our regularly occurring bi-monthly statewide call, May 14th. This call will be from 12 to 1 p.m. You can see the information here. We will be talking about a lot of these kind of pieces as we're able to get clarification on some of the parts. We'll also be bringing in some of the new resources that are being developed across the country for out of school time and summer programs like your own. So please turn into that call. We're also going to be starting to develop a series of other supports. You can reach me at my email address, or you can give me a phone call, 907-602-0569. We are at 1 o'clock, so I just want to thank you all again for joining the call. I want to thank both the Department of Ed and Department of Health for joining us as well. We will be synthesizing what we heard on today's call, as well as the recording and all your comments. We will be putting that together and lifting that up to state leadership. If folks would like to stay a little bit longer on the call, if you didn't get to ask any of your questions, please do so. We will be sending out this week as well a survey briefly for program operators or program owners to be able to share whether or not program you're expecting to be in operation, and if you have any additional questions that need clarification. I will stick online. We have some other folks, so feel free. Thank you for all you do to keep our kids safe, healthy, engaged, and supporting families. You know, you are all true, amazing heroes in our eyes, and we thank you so much for your dedication to our state. We are going to go ahead and leave the call open for a little bit longer. If anyone has any questions or things you'd like to talk through now, you're welcome to jump onto the call.
Hey, Thomas, this is Matt from Midnight Sun Council Boy Scouts in Fairbanks.
Hey, Matt.
You said something about, I just want to clarify, you said something about resident camps shouldn't be running this summer. Is that true?
As of now, this guidance does not meet the, is not part of residence camps. We're going to get some further clarification on that. We know there's a lot of questions about it. So we are going to be doing some digging, but as of now, this guidance is not meant to cover residential camps.
Okay, thank you.
And I did see, I think someone else put in there around, you know, would it fall underneath another for lodges or camping? But we'll seek some additional clarification on that.
All right, thank you, sir.
Great.
Hey, Thomas, this is Cheryl from Raleigh again. I have a question about the use of gyms. I know you were saying outside activities are preferred. However, with the large gymnasium available to us if we open our program, if you're only having 10 kids in there for physical activity, is that outside of the requirements, or do you know?
So the current mandate, I'm just going to pull that up. So physical exertion must only take place outside. So what you you can't use gymnasium for tag or basketball or soccer or anything like that. It should take place outside, as is the mandate. What you could utilize the gym for, though, is an additional programming space, or there could be some, you know, I've seen lots of creative ways that kids are still doing it, where they're playing like different types of activities and that don't require physical exertion.
Hi, it's Eva. So there were a lot of people from Rural Cap that were trying to get on, and because of the max capacity, they jumped off. So my question is, when will the recording be available? And are you sending that out as a link so that I could share that with my colleagues with Rural Cap and some of the Alaska grantees?
Yeah, so Eva, that's a great question. And first off, like we were thrilled, we saw that in your newsletter that it went out. We definitely had more folks than we expected for it being such a short turnaround because of just the timing of setting up the call. We will be taking the recording. We're going to see the quality of the recording, if it makes sense to post that and or just synthesize the notes. What we are putting together right now, as we'll be sending out, is the link as well that will have really a survey to find out if programs are in operation this summer. So that includes culture camps or kind of other tribal youth programs as well, to be able to find out what questions and concerns they have too. If we find out, you know, again, we're not expecting to go over 150 today. If we need be, we may open up another kind of listening session, or if you'd like, we could maybe even strategize trying to host something similar to be able to raise those up. Really, the key point is we're trying to bring together as many voices about what are the challenges of meeting the mandate, what are concerns around it, where do we need further guidance, so we can share that with department leadership.
One more question. The mandate, will that be included in the email too, with the link for the recording?
Yep. So the mandate, yeah, you can also Google it as well. It's right on the state health page. Is mandate 16 attachment I. But I'll make sure to email that to you as well. I'll send that to you and Joy and the kind of rest of the Rural Cap crew.
Thank you so much, Thomas.
And Eva, if you want to take me up on my offer too, I'm welcome. You know, if there's kind of a need to kind of organize maybe a tribal call as well, that's something that we can figure out.
That would be, I think, beneficial to the TYP grantees. So yeah, I'll take you up on that offer.
All right, let's connect offline and we can figure out some details.
Perfect. Kayla Rome is also agreeing to a tribal call. So maybe we could include Kayla. Is anyone else going to be there too?
I think there is a good chunk of folks too that could. Excellent. So I'm seeing a few other folks responding to that as well. That's something we can look at and explore. Eva, do you have my email address correct?
I do, yes.
Can you just shoot me an email so we can start that kind of email thread going and think through it? Because I think there's some other partners we could grab as well to help kind of organize it. This was a very quick, we had 48 hours to get this call together, so we didn't get all the outreach we would have, and I know there's a lot of other folks who would like to.
Well, in 48 hours turnaround time, you guys did an excellent job. Thank you.
Great. Well, I'm glad it was valuable. Any other comments, questions that folks have?
This is Rebecca. Sorry.
Go ahead, Rebecca.
This is Rebecca Strong from Connect again. Just one more thing. It got a little fuzzy on the phone during the social distancing part for the group.
Mm-hmm.
It sounded like keeping the groups apart, but social distancing wasn't expected within the group, which is not how I read the reg. So I'm just trying to get clarification on that statement.
We will get some further clarification on that as well. To my understanding, we're always looking. The more we can get to keep separate, the better. But I believe in the group, so the group of 10 is able to say if there's a picnic table, I believe they do not need to be socially distanced 6 feet apart from there. We know that there are just some fundamental challenges with keeping kids separate. I mean, if you anytime you see a group in a field, they always seem to run into each other as kids. So we will get some further clarification on that, but I believe it's just the groups of 10 have to stay apart.
Okay.
So say if 5 kids get picked up from each group, they're not allowed to merge the 2 groups together. Those 2 groups should remain separate for the day and for that time.
Yes. Basically, they have their own program.
Yep. Yeah.
Yeah, in the mandate, it's written out, social distancing should be encouraged whenever possible with an understanding on limitations in social distancing in young children. So that's what we have for now. And I think back to, there's also a question in regards to kind of the iterative process of these mandates. And, this is part of the process. So we take, we're listening, we take these questions back to leadership to further clarify. And I did see further on earlier in the chat box that Becky Morrissey, the section chief from Women's Children Family Health, had indicated that they're working on a mandate that really separates childcare from day camps. And I think that will be another opportunity to kind of further clarify, because there are some pretty unique and distinct differences between those 2 types of, providers. So again, this is iterative as we kind of move through looking at the data with phase 1 and into phase 2. We don't know in phase 2, we don't have that information in front of us or crystal ball. But when we get there, we'll make sure that we do update the mandates as the data kind of dictates.
Hi, this is Tyler with Youth 360 and the MAPS 2. Following up on that comment of each kid kind of has their own program, is the converse also true that an individual staff member should only be contacting with no more than 10 kids over the course of a program? And if so, is it possible to run multiple rounds of quote unquote programs? I hope I'm not overcomplicating this. Thank you.
That's a great question. Yes, so the staff should not rotate. So we know some programs do that. So say they have 3 groups, even outside of COVID, some programs have 3 groups of 10 kids each. And they have one of their leaders is the arts and crafts person, one's a science person, one's the, we'll say, theater person. And then typically the staff member rotates and the kids stay the same. That should not be the case this time. The staff members should stay with that group of 10. That's, again, one of those areas where we're finding clarification. So someone like yourself, who's a director, your ability to go out and check in on groups, so we're seeking some clarification as to what exactly that looks like. but it should be that staff member staying with that group for the day.
Yeah, I'm clear on the kind of what a day would look like, but I'm thinking longer term over the course of a week or a month. Should that staff member only contact 10 children during that time?
That's something we can seek some clarification on, and what's the recommendation. I'm going to say my non-official response would be, my gut is saying, you know, that having that opportunity for that staff member to build bonding connections over the course of a week in particular, and having, you know, that period of the weekend where they're not in contact, you know, that does give a buffer zone for it. I think it's a great opportunity for that staff member really to again, engage deeply in building those relationships with kids. That is a pretty typical procedure around summer camps, that we'll see the same staff member who may have the same campers for all 12 weeks of summer. So, but we'll seek some clarification on that for you.
Thank you.
Hey, Thomas, this is Anna. I'm not sure if you saw Matthew's question from Canna earlier in the chat. I'm not sure if he's still on, but he asked, do requirements about limiting the sharing of high-touch items, including the use of balls, frisbees, etc. Oh, do the requirements about limiting apply to high-touch items such as balls, frisbees, etc. during games?
So yeah, so that would, so high touch items where we are like, so things such as sports equipment. So for example, you have a group of kids who are playing basketball outside. After that basketball is done being used by that group, that should be sanitized before the next group is able to utilize it. And I see,
Hi, this
Cheryl.
is Heather Helzer.
Yep, go ahead, Heather.
Okay. Hey, this is Heather Helzer. I'm turning in training kids triathlon camp. My big question is, I'm going to have different groups so that I'm able to have more than 10 kids. I'm going to do testing beforehand to have families determine if their kid is in the beginner, intermediate, or advanced group. But there's obviously still the risk that a kid might be in the wrong group. Is there a way to move a child to another group after the first day if they really do not belong, you know, in the advanced group?
Yeah. Heather, that's a great, and I don't think we've ever connected before, so please shoot me an email so we can stay connected. That's a great question. It's something we can seek some clarification on. We know that regardless of whether it's a sports program like yours or another, there may just be a behavioral challenge or something else that causes that child to not be a good fit for the group. We want to ensure that the child is being supported and has a positive experience. So we will seek some clarification on that ability to move, and we'll get back to you on that. So I don't want to speak on that if I'm not certain on that, but we'll get some guidance on there.
Okay, thank you.
Hey, Thomas, while you're asking for guidance, we have a couple of questions from Raleigh. This is Cheryl. Yep. Covering staff lunches and breaks, mandatory breaks, also in the case of a staff illness, if we end up replacing that staff person with a substitute, does that mean that that sub's basically only able to sub for that group unless 2 weeks have gone by, or what is the requirement there?
That's a great question. I saw it in the chat box. I think that's something we are going to have to seek some clarification, because not only do we need to meet the health mandate, we also need to meet federal employment law and state employment law on giving folks breaks and that. So we will bring that back and seek some clarification about that and what exactly that looks like, especially in regards to breaks, lunch, and staff illness.
Right, thank you. I'd appreciate that.
Other questions? I see Matthew from Kayana, you put groups and staff assignments change over time as a result. of conflicts, participants joining and leaving, staff becoming unavailable, etc. Yeah, so that we're going to just have to seek some clarification as to what's the best practice on that. We cannot control a lot of those variables. We are all human beings, and sometimes we know kids or staff don't blend well with each other, or other things can happen. So we will find out, and we'll bring that up to leadership to get some clarification on that guidance. Any other questions or comments folks have in regards to meeting the House mandate? These have been really great questions. We really appreciate folks sticking on for those that wanted to ask more.
So regarding groups of 10 children for an event or an activity, let's say 13 kids show up. Is it the first come first serve basis? I mean, how do we handle something like that?
Yeah. And I'm sorry, who was this that just spoke?
Eva.
That's Eva. So Eva, this is one of those things that, again, fundamentally this summer, programs are probably going to have to change some of their operation to include things like registration or signups and or having additional staff capacity for that. This is one of those things as well, like I said, for like a teen drop-in center, that can be a real challenge because you never know how many kids are going to come in. One day you could have 6, the next day you could have 13, and the day after you could have 19. But the mandate still does apply for that, so they have to be in groups of less than 10. So that is going to be kind of a structural piece that programs and communities are going to have to think through. Is how do they get kids to more actively commit to signing up, or families commit to signing up, to understanding the mandate, which is part of the requirement, is that children and family are notified about the mandate. So that is something that I think would be really great for us to discuss with on that kind of a rural or that tribal call that we were talking about, because it is going to look really different. I'm pretty familiar with a lot of tribal youth programs where it is, hey, it's any kid who walks in that day. Some days, everyone was out late the night before because fish were moving, and kids are slow to get into program, not many kids. And then other days you have every kid in the village that's there. So I think we're going to have to think through that and think creatively on how do we help support that and ensure that we're meeting the mandate and keeping kids safe.
All right, so I already sent a text message to Joy about the tribal call.
Great.
Hey, Thomas, this is Darren with 4-H.
Hey, Darren.
Hi. Hey, I did have a couple questions up the line on the chat. I was just wondering about the screening. I was confused because it's saying that youth are to be screened on the way in, if a touchless thermometer is available, they'll do temperature checks. I was surprised that a touchless thermometer is not required and that temperature checking is not required, because I just don't know of any other way that it's to be done.
Yep. So there's a couple different forms that we've had come through. I'm going to pull one. Are you still on the go-to?
Yes.
I'm going to see if I can find it because I have a flurry of emails that came in. So I will not be able to find it right now, but I can send it to you. So one of the things we've seen child care providers here in state do is they have an interview checklist that they do with each child or family. In daycare settings, been the parent because the child's typically under the age of 5. And so what they ask is, has the child had a fever in the last 72? They'll ask things such as, have they had a cough? Have they had a sore throat? So they're doing some of those screenings pieces that way. In lieu of that, they're not able to have that touchless thermometer. Because we know right now those type of supplies and demand are hard to come by. And so, it gives a little bit of flexibility, but that's something, again, we will help hopefully get some clarification and some guidance on. We're going to be working on some sample templates like that we'll be able to share out to the field. Will just be free open source for folks to use. But that's one of the ways that you can help meet the mandate by screening families that way as they come into program.
Every day. Okay.
Yep. Yeah, it should be every day that the child comes to program.
Mm-hmm. Okay. And then just one last, I was also wondering about the PPEs. I was just surprised to hear that our camp nurse who's going to be bopping from kid to kid, as little and major and not so little things happen, that they are, it seemed like a prime vector, and it just seems like the N95s would be warranted in that case, or required in that case, and that they're front line. But that was just what my sense on it.
Yeah, so that's again.
This is Eliza Thomas. Darren, I think the specifics around that you're talking about a nurse in this case, absolutely. That would be frontline staff where the use of that medical grade equipment is 100% warranted.
Okay, great. Thank you.
Yeah.
And that's, Darren, what I was going to say too, that's something that we will bring forth too, because right now in the mandate, it's just talking about cloth masks by staff. So I think that is something that we really need to get some clarification on, because the number of camp programs that have nurses or have an EMT on site, that is part of their staffing, that we'll just have to seek some additional clarification or guidance on that as well.
Great. Thank you all very much.
Yeah.
Thomas, this is Jeannie again with the U.S. Forest Service. And would you include, I sent you an email to be included in any video or updates or anything, but would you also include the answers to these questions and also the screening template that you had brought up?
Yeah, we're going to be working on kind of compiling a resource guide. The kind of benefit of this is that we have a robust early childhood system that has been operating definitely a reduced capacity during this crisis, but they've been developing some of it. We're also part of a 50-state after-school network, so we're really tapping into expertise all across the state and across the country for this. So our hope is to be able to compile that as a resource list that would be available free for programs to be able to go in and do. So yes, that is what we're working towards. And thank you for shooting the email and joining the call.
Thank you.
Hi, Thomas. This is Julie Niederhauser from the Alaska State Library. My apologies for joining you late, but did you guys talk about libraries at all?
So we didn't, and I would put a caveat. So right now the mandate covers any summer programming. So that would be, and we can seek clarification on this, but to my understanding, that would also include if a public library, so say I'll use example here in Anchorage, the Lusac Library runs a reading program in which groups come in, or their volunteer program, or a code camp. They're going to have to follow the mandate based on them being that youth program. Now, with that being said, I think we do need to probably seek some further guidance because whether or not that this does not just open public libraries, this is really about youth programming. So I think we're going to probably need to work together and think of what's some guidance for those librarians out there.
Thank you, Thomas. I would appreciate working with you on that.
Great. If you can shoot me an email about that, just so it's in my box after the call, so that I make sure to follow up, that would be great.
I will do that. Thank you.
Super. And John, I see your comment about sleeping. It looks like Margine from Sitka is putting there's some guidance from Child Care Aware under resources. If you check underneath CDC as well for childcare, there'll be some guidance around sleeping. Any form of napping or sleep time should, for that, as long as it's not overnight. But that napping, that should again follow that guidance of social distancing, and with the area where the napping is occurring should be able to be sanitized. But there's a whole bunch of guidance from CDC on that we can help you pull up and look for it as well. And it's no worry about being late. Turns out it started late. Yes, so Rudy asked a question in regards to screening children. Yes, you will be, you should be keeping track of that. That is part of our efforts to be able to track kid screening. So keeping a binder, this will be a really important piece that we're gonna help programs think through is what does your health log look like? It's real simple. It can be a real simple document of just something you're writing each day that lets you say, checked in with this kid, boop, 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 everything's good. Kid got a cut, boom. This is where we're putting in the health log. Part of that helps us also, well, not helps us, but this will help the state in case there is an infection to be able to do contact tracing and get some of that history as well. So we are encouraging programs. You should keep track of those medical logs this year. And that's something we'll be helping out with finding some guidance. Other questions? I'm seeing a bunch coming in typing wise.
Can I make a quick comment on what you just said there? If it's just a one-day event, do we need to have a health log on each child?
It depends. I would say, you're having to weigh in whether or not it is worth the risk of having that one-day event, is what I would say. So we are still in the midst of the pandemic, even though we are talking about opening up services. I would always, and I'm happy to talk offline with you more too about whether or not it makes sense for that programming to happen this year, or delaying or looking at others. This guidance was not designed for a one-time meetup, because right now most municipal codes or borough codes prohibit gatherings, and I think, and this is where we'll seek clarification, if that would be considered a gathering opposed to a youth program. So we're going to have to seek some guidance on that. But thank you for raising that, because I think we're going to run into that with others as well.
All right, thank you.
Matthew, your question there, we just need a little more clarification on your program. So if you would, we can chat maybe offline a little bit more about your specific program. But yes, the child is supposed to be screened each day coming into program. That maybe, if on the developmentally appropriate side, that would be really figuring out whether that young person has the capacity to do their own check-in with staff to say, this is where I'm at. It's going to be based some off of your policy and procedures, and also in meeting that guidance. So Matthew, I'm happy to think a little bit more, but you're welcome to shoot me an email to set up a time to chat, or you can give me a call. Any other questions, comments?
Thomas, this is Julie Niederhauser again. I noticed this is being recorded. Are you going to be sharing it out to everyone who sends you an email?
So that is indeed our hope. But as we saw at the beginning of the call, when I kept getting kicked off the call as the organizer because we had too many people on the call, sometimes technology always isn't in our side. I think that's the thing we've all learned from this pandemic. Zoom, GoToMeeting, and all these are great, but they don't always work as great as they should. So that is our hope. What we are going to be doing, though, is we're transcribing the call as well from the questions that have gone in the box to be able to elevate that up and out to others. Again, I'm not a medical expert. I do not speak for the state of Alaska. So please just be advised, ultimately the state or your local health authority does have kind of final say as to what is meeting the mandate.
Thank you.
any other comments, questions, or concerns you'd like to raise? I'm amazed folks stuck on an extra half an hour. We're going to give folks a little bit longer. I'm still seeing folks signed on. Again, we'll give you about another 10 minutes until, well, 8 minutes we'll give until 1:40. If we don't hear anything, then we will shut the call at 1:40. And thank you for all those who have joined and attend. Our hope is really to be able to not reinvent the wheel. If you feel like you're reinventing the wheel on something, contact us, because we'd love to get you in contact with another program that has probably already designed the thing that you're trying to design. So we are here as a resource. Our team is here to help out and think through anything. We also are going to be actively working with our partners with the state of Alaska, as well as our 50-state Afterschool Network, to be able to help really reduce the amount of confusion and energy that folks are spending in terms of creating new things. So thank you all again for joining the call. I'm going to stick around for another 7 minutes unless there are any other questions. Rudy, so that is not an absolute. We need to think through what your program looks like and what's the age of the children. So that is something, again, we will seek some clarification on in regards to that parent drop-off, or if the student can walk themselves. We know for a huge number of programs, that child gets themselves to program every day, and or the program may provide transportation like a bus to the location. So that's something we're going to be working on figuring out, that we'll seek some clarification on. But feel free to reach out to me and we can talk through. I'm just not super familiar what program you're with. So if you want to contact me and just share a little bit more information on that, or if you want to jump on the call now and kind of share a little bit, we can chat it through now.
Yeah. Can you hear me?
We can, yeah. Is that Rudy?
Yes. So my name is Rudy Villegas. I'm a case manager for Canarsie Indian Tribe Youth Services. We run a summer program for 8 weeks with a week off for the 4th of July. Typically what we've done is we would usually get several vans and send multiple drivers and adults with each van to each of our students out through the whole Kenai Peninsula. However, with the pandemic, that doesn't seem like it's the greatest option. And I'm just curious to see if you've ever heard of other ideas of how to get the students to the school or wherever the program is located. Some of our students do walk, but that's a rarity.
Yeah.
Like literally only like 3 out of the 50 do that, older teenagers. Most of the families who work with do not have reliable transportation, or due to poverty levels, just are not able to, hence the reason why we go out to them, pick up their children, bring them to the program, have the program, and then at the end of the day, return them back.
Yeah. And Rudy, are yours all school age kids that you're working with?
Yes.
Yeah. Yeah, so this is exactly the thank you for raising that up, especially in the piece around vans picking up or other vehicles. That's something we right now have on the docket for getting clarification on. Lots of programs provide transportation from home to the program site for a variety of reasons. So that is one we're going to have to get back to about, yeah, and just seek some clarification. Right now we're just not sure.
Okay, thank you very much.
Okay. Any other comments, questions?
Have you talked about product at all, like the solutions to keep things clean, or is that totally off topic?
No, that is definitely on topic. And
Yay!
who's this on the call?
This is Mary, Anchorage Public Library, LUSAC, Youth Services Department. And my question is, when you fill the proper bleach water solution and you have a gallon of bleach water solution sitting on the property, how long can that solution be until it loses its potency to use? Do we have to fill a new gallon every day, or can we just use that gallon for the whole week?
Mary, I cannot answer that question myself. It's been a long day. I'm like scratching my head. I'm like, what did my old food handlers course tell me back in the day? I will, that's one of the things we had a couple people put in the chat box around sanitation about what's the best solutions, what products, what can we do to reduce the number of exposure to chemicals to children. So that's something we will seek some clarification around. What I would also recommend too as well is for you to reach out. My guess is because you're part of the municipality of Anchorage, they're going to have their own cleaning and sanitation procedures that you ultimately would be the thing that the public library would have to follow. So I would connect with, is it Elizabeth Nikolai is still the head of, I think, Youth Services as well, so I'd connect with her. But that's something that we'll be working on seeking some guidance on in regards to what's best practices around sanitation.
Thank you very much.
You're welcome.
This is Lori from Canarsie Indian Tribe.
Yep.
Can you hear me? Oh, hi.
Yeah.
I'm an infection preventionist, actually, and was invited by my behavioral health team who does youth services to join this call. So I just wanted to toss in response that bleach degrades after 1 day. So bleach should only be made for 24-hour use. And if you think a gallon, like I know I get the whole gallon, would it last me? Consider making a smaller amount. And then also on the state website, the State of Alaska COVID page, I'll find a link and pop it into the go-to meeting. There's actually, YKC developed a bleach routine. They have a lot in their region without running water, and so it was a question. And I think they had a really nice one-pager on making bleach as well, and the state actually linked onto that and put it on their page as a resource. So I'll try and find that while we're still in chat here and put that link in chat for you. But if I don't find it, that's where you can go as well. And of course, as Thomas said, reaching back out to your, the city for information too.
Lori, thank you for jumping. Yeah, appreciate it. Also, Eliza put in as well, CDC gives its recommendations on disinfecting building and facilities. That is a protocol that we should be following as well. So yeah, Lori, if you have that, I would love to take a look. That sounds like a great one-pager to share out with folks.
So I know that daycare centers have very stringent cleaning protocols. So that could be another avenue of information. And,
yes.
and
this mandate is for day camps and childcare. And so we're working with the early childhood field with Thread and several other early childhood partners to find out, since they've had programs operating throughout the pandemic, we are working on really being able to identify what are those practices and how can we adapt those to a very different program setting oftentimes that we're in different age range. But yeah, it's we have it on our radar to try and nail down some practices.
And yes, after 24 hours, bleach is compromised. So you have to make a new solution every day. I used to work at a daycare, so that's the one thing I remember.
Okay.
Yep. Got to get those bleach strips back in action these days. Great. Any last comments, questions that folks may have? And Lori did put the link in there as well for that document, so thank you, Lori, for doing that. All right, well, we are going to wrap up the call. Thank you again, all, especially those of you who stuck on this long. It was great connecting with so many of you we never connected with before. Please reach out to us so we can make sure you're on the listserv to be able to get updates and news and information.
Thank you.
You're welcome.